Good morning, good afternoon, good evening, everyone, and welcome to this webinar to launch the e-learning course on harmful practices data. My name is Claudia Cappa, and I have the privilege of working for the Data and Analytics section of UNICEF in New York headquarters. In today's webinar, we want to share with you this exciting initiative. Over the last 5 years, we worked together across UNICEF, bringing together data experts and practitioners to develop a training that is intended to strengthen the capacity of UNICEF and non-UNICEF partners working on harmful traditional practices. In UNICEF, we strongly believe that the right data in the right hand can transform lives. This course is intended to show how data can be used for advocacy, programming, and policy making to improve the lives of children across the world. To give you a sense of the training and the e-learning opportunity, we are going to present the content of the training. We are going to have a distinguished panelist who is going to join us to make opening and closing remarks. But we also want to start with a very quick video that gives you, in a couple of minutes, a sense of what this training is about.
Every year, millions of girls around the world become child brides or undergo a procedure known as female genital mutilation. These life-changing events usually imposed by others, violate girls' rights and compromise their health and development. Target 5.3 of the Sustainable Development Goals aims to eliminate these harmful practices by 2030. Understanding a problem is essential to its solution, and that's where high-quality data come in. Data can help shape interventions that are strategic and targeted. They can reveal how much progress is achieved and where, fostering accountability. UNICEF has developed a new self-paced e-learning course for development practitioners, harnessing the power of data to end harmful practices. The aim of the course is to build knowledge on the collection, analysis, interpretation, and use of data on child marriage and female genital mutilation. Through the course, participants will be taken on a data journey. It starts with determining data needs and discovering the main data sources. It then moves to understanding key indicators used to measure these practices and how to interpret the results. It concludes with using data for advocacy and for influencing decision-making. By the end of the course, participants will have the knowledge and confidence they need to use data as a catalyst for action, thereby giving girls around the world a fairer chance in life.
And now, to give you an actual preview of the type of knowledge you are going to be able to acquire through this course, we want to run a quick test to test your statistical knowledge about FGM and child marriage, but also the underlying statistical concept that are going to be covered in the training. So if you would like, you can scan this code or go on menti.com and enter the access code 73 74 39 67. And we will run a couple of questions to give you really a flavor of what this training is about and the actual knowledge, again, that will be acquired through attending this training. Hopefully it's not going to scare anybody off, but actually give you a sense of the richness of the information you will be able to find. So we're going to give you a minute to be able to go into the menti.com. You can also use your QR code. Okay, I think we are all set. Let's start with a question on a critical measure of child marriage and female genital mutilation. We need to understand how widespread are these issues before we can tackle them, either through advocacy or programming. So the first question that we have here, what is the main source of data on child marriage and female genital mutilation when it comes to prevalence data? So meaning data that give you a sense of how prevalent these issues are. Would that be administrative data, sample-based household surveys, opinion polls, or qualitative data sources? So let's pause a little bit because I see we might have some more people participating. Nobody is saying opinion polls, which is reassuring. So we have a few people indicating that administrative data are the right source of data on prevalence of these practices. The majority seems to converge towards sample-based household surveys. A few people have indicated qualitative data sources. And the correct response is sample-based household surveys. So administrative records cannot give you a sense of how widespread these practices are. Why? Because administrative records are collected in the context of service delivery. So those who access the service provide information that is captured for the purpose of planning and recording access to the service. So think about this when applied to FGM or child marriage. What type of services women who have been affected by this practice can reach out to? And would it be a complete picture? No, because not all women who are affected by FGM or child marriage reach out through a service. So the correct answer is sample-based household surveys that are a critical source of data on FGM and child marriage in general, because through these surveys, all women of a certain age are interviewed and questions are asked about the age at first marriage or whether they have undergone the practice of female genital mutilation. We cannot obtain prevalence data from qualitative data sources. Qualitative data sources give us important insight into how things happen, but not quantitative data about how widespread practice is. So as those working on female genital mutilation and FGM, we need data to guide our intervention. And we need to be able to master the basic concept that will allow us to understand what are the good data sources that can guide our advocacy and our programmatic work. So let's go into the next questions. And again, we wanted to show you the breadth of the content you will find on this e-learning course that covers not only concept, but also actual way in which the data can be displayed. And there are specific forms of graph, for example, that are best used and suited for displaying statistical information. So this question asks, let's take the example of that you want to visualize data on the prevalence of child marriage, comparing values across different regions. It's a very important type of information, right? Because if we want to focus our intervention, we need to be able to identify, for instance, the high prevalence regions. What type of charts is the best option for displaying, for instance, difference in levels of FGM or child marriage across region? Would it be a bar or a column chart? A pie chart? Would it be a line chart or a stacked bar chart? So most people seems to converge towards bar or column chart. A few people are saying a pie chart. We have two supporters of line charts, and a couple of people also indicating that stacked bar will be best suited for that. Well, the choice of the chart depends on the indicators we want to display, and obviously a number of other considerations. But when comparing two prevalence level, it will not be appropriate to use a pie chart because pie charts tend to work with distributions. So you have an entire population and you distribute the population across two categories, or 3 or 4 categories that are expected to be mutually exclusive. So a bar or column chart allow you to see 2 bars next to each other I'm oversimplifying, of course, and this is the best way to display disparity. Of course, again, it's not the chart in itself, it's the chart in combination with the indicators that allow you to understand how to best display statistical data. And that's what the training will also explain. Explain not only how to gather the data, but also how to analyze the data and how to visualize the data. And this also is important from the user of data perspective, because when you look at a chart, you need to be able to interpret correctly. So let's go now to the next question. Which of the 3 core indicators, among these 3 indicators, which one is the main one that is used to measure the prevalence of female genital mutilation? Again, we want to measure how widespread female genital mutilation is in a given population. So the prevalence, which can, again, in an oversimplified way, we can indicate as being the proportion of women affected. So which one of these indicators is the correct one that is mainly used to indicate the prevalence of FGM? Would it be the number of girls and women of all ages who have undergone FGM? Would it be the percentage of young girls, 0-14, who have undergone FGM? Or would it be the percentage of girls and women 15 to 49, so women of reproductive age, who have undergone FGM? That's the core indicator, which is also used for official SDG reporting. So the majority of people on this webinar are correctly mentioned that it is the percentage of girls and women aged 15 to 49 who have undergone FGM. Why is this indicator as opposed to the other ones that we presented in the same slide? There are, of course, a number of reasons which we go over in the training. And now we go more into statistical concept. The next question asks about a measurement tool, a way of capturing phenomena that consistently finds level of female genital mutilation are half the true prevalence of the practice. Would that be considered an instrument that is neither reliable nor valid, valid and reliable, reliable but not valid, valid but not reliable? I mean, these words have a specific meaning in statistical terms. So validity and reliability are 2 very important concepts to master. And of course, we don't expect everybody already to master this concept, but at the end of the training, hopefully, you will feel confident in using these technical terms and also interpreting the instrument, the measures that convey validity and reliability in a confident manner. So here people are a little bit more split. It looks like there is a little bit of more hesitancy in answering, which is completely understandable, justified. So it looked like most people indicated that this is valid and reliable. Well, actually it's reliable but not valid. So systematically you get the same measurement, but the measurement does not capture the true prevalence of the issue. Yeah, so you can get things reliably wrong, meaning multiple times you get the same measurement. It doesn't mean that the measurement is correct. It's reliable, but it's not valid because it's not capturing the true extent of the problem. So that's very important because you can be systematically wrong, right? You want to be systematically right and correct in capturing the phenomena that you have at stake. Yeah. So I hope you found this interesting. Again, it was a teaser to allow you to see where you stand with some of the statistical concept and what else you can acquire if you decide to take this training. We are going to give you information on how to enroll in this training. It's a public good, which we really hope is going to help those working on female genital mutilation and child marriage. So, and now without further ado, it's my pleasure to introduce Veronica Camango Ninjico, who is Senior Advisor for Child Protection, focusing on the prevention of harmful practices in our program group division in UNICEF headquarters. Veronica has been a champion not only of the fight against FGM and child marriage, but also the importance of data to promote an end to this practice. So it's a great pleasure for us to have her. She's our biggest fan and supporter. So thank you, Veronica, for being with us, and the floor is yours.
Thank you so much, Claudia, and thank you so much for the collaboration between Child Protection and Data Analytics team. I think, as Claudia has mentioned, I think the power of data cannot be overemphasized in the work that we do to eliminate harmful practices, particularly child marriage and female genital mutilation. Good evening and good morning, everyone, from wherever you're joining. I think at this particular juncture, I would say that I'm happy to join the launch of this e-learning, which is the second one. I think the first one happened in March. We did the margins of the CSW, and joining for the first time also to segment the importance of having data, or also enhancing partners' capacity in collecting or harnessing or utilizing data to eliminate FGM or child marriage is critical. I think from the harmful practices team of child marriage, just like our data analytics team, at the heart of our mission to eliminate child marriage and FGM by 2030 or before 2030 lies the power of data. And as Claudia mentioned earlier on, working in this area, FGM and child marriage, we need data. And we have seen how data has been critical in pointing us or helping us as an ecosystem to where we need to focus, particularly on eliminating or pushing the agenda forward. And data is very crucial, as Claudia has mentioned, in accelerating progress in ending these harmful practices in alignment with SDG goals, particularly 5.3. And from the harmful practices team, we've seen data and the partnership with a data analytics team, that this has empowered not only the beneficiaries, but also as program colleagues and those championing advocacy to identify the regions and communities where harmful practices are most prevalent, where we are making progress, where we need to change from gear 2 to gear 3, thanks to the collaboration with Claudia and the team, who have been instrumental not only helping UNICEF team, but the entire ecosystem to inform where programming needs to be accelerated and where we need to advocate more, particularly around harmful practices. And it also helps us to track progress, guide evidence-based intervention. Now we have 5 years before SDG. Where do we need to focus more? Where there's evidence that there's impact, there's scale, the intervention that we must slow down to achieve the SDG 5.3. Now I think if I don't take you to a few specific countries where the work that Claudia and team do has really been instrumental in our work, I would do injustice to the work or to the launch for this e-learning. We have seen transformative impact on data through our country level efforts. Let me just mention 2 examples. I think first in South Asia, in Bangladesh, thanks to the household survey, which our data analytics team have been supporting with the government of Bangladesh, it indeed revealed persistent high level of child marriage in that particular country. And then it also pointed out to areas where we need to accelerate action. Through these household surveys in Bangladesh, we have seen a national action plan, the government refocusing on where we need to accelerate efforts in ending child marriage. We've seen increased targeted intervention around access to girls' education, because there's a lot of out-of-school girls issue there, and also the whole issue of enforcing child marriage law in Bangladesh, thanks to the power of data. Now, let me take you also to Africa, particularly our only spotlight, Burkina Faso. I think high quality data also has enabled us to reach the most marginalized, particularly ensuring that no girl is left behind. Within the Burkina Faso survey, data identified female genital mutilation hotspots, where they were the hotspots of female genital mutilation, particularly among marginalized community. I think these insights that we got from household survey, it also led for us to support targeted intervention, particularly focusing on those hotspots and those marginalized community, which has contributed also to lower the prevalence of female genital mutilation within Burkina Faso, and a huge thanks to the power of data and evidence. With these two examples, ladies and gentlemen, I think I would still emphasize that recognizing the power of data to catalyze change, it is critical, and more critical now that we have 5 years before the SDG. Where do we need to focus efforts? Where do we need to build more skills? Who needs the skills, so that we can all work together as an ecosystem to produce, to generate, to analyze, and to harness what data is pointing us to where we need accelerated efforts. I think a lot Claudia has mentioned, and I think through the subsequent section, we'll also see in terms of how best we need to harness this data. And through the Mentimeter, I think I must admit I'm an expert, as Claudia mentioned, in this area. But in terms of also how I play around with data, I've convinced myself that I need to enroll in this course. So without further ado, ladies and gentlemen, let us remember that data remains a bedrock of our mission to end harmful practices. And from a harmful practices team, we cannot do anything without data analytics team. We cannot program in terms of where we need to accelerate effort. We cannot advocate with member states in terms of areas of critical advocacy to make meaningful change without what data is telling us. And this is a public good that is benefiting the entire ecosystem, not only member states or UNICEF, but every other actor who is working in this area. So I'm really looking forward to seeing many of you joining today, or also reaching out to colleagues to enroll in this course. I think is a game changer to all of us, and together we must ensure that our efforts are not only sustained by but amplified, so that every girl, every child can grow free from threats of harmful practices. They can only grow free from harmful practices if we are able to utilize and harness data for evidence-based programming, evidence-based advocacy, and indeed resource allocation based on where efforts have to go. With those few remarks, congratulations once again, our data analytics team. We are working as a team, and this is one of the huge milestones that I do take pride as a team lead in harmful practices. Thank you so much.
Thank you so much, Vero, for these inspiring words. And this has been indeed the work of many, the culmination of 5 years of work. And the most insightful contributions were actually coming from the colleagues from the programmatic side who attended the online training and the in-person training that we hosted over the years. And it's through their feedback that we have been able to refine this training, because this training is meant to be relevant, useful, and understandable for non-data people. So it's really this collaboration between the data and analytics team and the colleagues working at the programmatic level that shaped up the content of the training. And I'm very pleased to see that some of the participants to the earlier trainings are with us today. They've been really generous with their time and their feedback. So I wanted to take a moment to appreciate them for having helped us fine-tune the training. There was a big team behind the production of the training, from content experts to researchers to designers and editors and copy editors. So you can imagine a training of this volume will require really teamwork and dedication. And nobody has been more dedicated to this training than Colleen Murray, who is with us today, and she will be giving an introduction of the training. And before giving her the floor, I also want to acknowledge Archana Dwivedi, who has been the project manager behind the training. You will not see her today. She's with us. She will not have a speaking role, but I wanted to take a moment to acknowledge both. Colleen, the floor is yours. Thank you.
Thank you, Claudia. So it's my pleasure today to be able to present this, this course to you that's now live on Agora and ready for learners to come in and get started. So today in my presentation of the course, I'll outline a bit about why we developed the course, what we hope it will achieve, and give you a preview of, if you come in and join us and enroll, what it is that you'll learn. Now, I want to start by reiterating a point that Claudia just made, which is that this course was not developed for statisticians, and it was not developed to be an academic learning in order to turn you into a statistician. It really was developed with a particular audience involved, and this audience is the colleagues who are working programmatically in the field on harmful practices. And we work with these colleagues a lot and have learned over the years that really a lot is asked of practitioners working in the field from a data perspective. So on top of the work that they and that you all do in the effort to end harmful practices, we've pulled together just an illustrative example here of some of the things that are asked of you all, right? So things like reporting to donors on impact, things like preparing fact sheets, either for journalists or for activists, giving interviews, discerning between different types of data to try to understand which one is of the best quality, supporting your government counterparts to set national targets. Things like these require a really deep and nuanced understanding of data and of evidence. And it's not necessarily a skill set that automatically, comes with a job. So that's why we developed this course to really help bolster those skills for these colleagues. We also know that historically, child protection has been one of the sectors where data in the past was quite a bit less strong than, for instance, sectors like education or health, where data systems were developed a bit earlier. We do know now, though, that evidence is becoming more and more available, particularly on harmful practices. We have a lot of data on child marriage and FGM. And so as the evidence becomes more available in this sector, we really are hopeful that practitioners who do have knowledge of the data environment and do have the skills to analyze and interpret the data will be able to make the most of it. So this is really our vision for the course. We also found that in trying to realize this vision, that there is a real scarcity of existing resources in order to develop these skills. So there are a lot of resources, for people who are already data people in order to learn more niche skills, but there aren't a lot of resources that are meant to be a real practical learning tool for people who are already working in the field and have a great subject matter expertise, but don't have necessarily the full set of background and knowledge and skills on data. So this particular niche was empty in our experience, and so that's why we went ahead and developed the course to meet that need. Now, overall, our vision for implementing this course broadly is really to build a network of data champions on harmful practices. And we really treasure those who have already taken the course and who have already become our data champions on harmful practices. We see this kind of network as people who bring three things in particular. So one, that you have the knowledge, skills, and confidence to use data to effectively guide your work. Second, that you are able to really become advocates for the generation, analysis, and use of data on harmful practices. And third, that your programs and your resources are able to be targeted as effectively as they can in order to meet girls most in need. And we think that by using data effectively, this is really the best way to make sure that that happens. I'll just share a couple of words on how the course was developed. So the content of the course has been under development for about 4 years now. It was first delivered as kind of a webinar style class during COVID times. We had hoped actually to start out doing it live, but we're constrained, and so did it online in 4 cohorts from 2021 to 2023. So in that case, we were sort of delivering it half a day every day for 2 weeks. And we also did one in classroom course that was a full week in 2024. So on the basis of everything that we learned, both in terms of what content was delivered, how the content was delivered, what people had more questions about, what needed some more exercises versus, different types of delivery. We really learned a lot from the students who have taken the course so far. Based on all of that feedback, we've converted the content into this e-learning course. And so we hope that this will make the content more broadly available and also a bit more convenient, hopefully, for people who cannot dedicate a full week at a time or 2 weeks, so that they can take the course at their own pace and also keep the resources in hand to always go back to as needed. Also, with it being hosted on Agora, it's open, of course, to our UNICEF internal colleagues, but it's also open to all partners, so can be shared publicly. We also wanted to just take the opportunity to share a few short words from some of our dear colleagues and participants about, they were gracious enough to share some words about what they learned. So these are students who took the course already, and they shared with us a little bit about what they took away from it. So please allow me to just screen a couple of these brief messages.
A key takeaway for me was that data isn't just about generating more new information, but it's also about using existing data more effectively. I learned how to define data gaps and data needs, and the training was very important in terms of strengthening my skills on data analysis, data visualization, and communication. These are all very important to our efforts in child marriage in South Asia.
Attending this training at Princeton has completely changed the way I view and use data and how I present it in documents like proposal or donor reports. This training really realized me not only the importance of data, but its power for advocacy and resource mobilization. So I encourage all staff working in the area of harmful practice to attend this training.
The course was very inspiring. With the knowledge I gained from the course, I implemented a real-time data collection system with child protection focal point in villages and using RapidPro to track new child marriage cases. This enables timely insight for program. I highly recommend this course to my UNICEF colleague. I think it's a game changer for evidence generation.
I feel now more confident to identify the data needs in my work and also to decide on the best tools to use to fill these data gaps. So I feel now I have more knowledge and skills to advise the national partners, including the National Committee, to generate evidence for the girls in Egypt. One key takeaway is not to focus only on the prevalence rate, but to focus also on the burden and the absolute numbers and other relevant indicators. Because after all, the girls are not just numbers. They are lives, and quality data could help us telling their stories.
So moving on, I'd like to share a bit of the course content to give you a preview of what it is that you'll learn in the course. So the course is it's organized in a series of 8 modules that really build on each other. So it's designed to be taken, incomplete in order. It starts out with basic questions like, why do we need data on harmful practices at all? And so the first module goes through understanding evaluating data needs. So helping you formulate what is the question that you're trying to answer and how might you use data to answer that question. Moving directly after that, we look at what types of data are best suited to our needs. So once we've really formulated a precise data need, how do we know which type of data we might use in order to best meet that need? So in the second module, we go through really one by one, each different type of data source that's relevant in the field. We cover things like, of course, sample-based household surveys, but also administrative data, qualitative data, big data, and really go through what type of data is offered by these different types of sources and the strengths and weaknesses that each one offers. Next, we explore how we can tell whether data are of good quality. So in Module 3, we look at all the different ways to assess data quality. We look at things like reliability and validity that you saw in the quiz that we went over a bit earlier, as well as several more dimensions of data quality. We also look at how to fill data gaps, looking at things like proxy measures. Next, we look at how do we turn data into insights. So Module 4 is a really rich module about data analysis and interpretation. We look at all different types of methods of both descriptive and inferential statistics, and really focus on what each different analytical technique can bring to you, really teaching directly, how to do and how to calculate some of these. And then for some of the other more advanced techniques, helping you understand, what the purpose of these types of analytical techniques are, so that if you encounter them in your work, why someone did that and what the results might mean, even if it's not something that you necessarily would learn to do yourself. In Module 5, we look at how to bring data to life by looking at different types of data visualizations. So understanding how we can use different types of charts, maps, infographics, and which one is best suited for different types of indicators. But following that, we have 2 modules that are dedicated to each of the harmful practices that are focused on in this course. So one on child marriage and one on female genital mutilation. And here we look at really how we measure these in the field, look at things like the prevalence and burden, but also different circumstances surrounding them, and give you a better understanding of what type of data is out there, what it means, and where it came from. And then lastly, we have a nice module, I think, on how we can use data to tell a compelling story. So it's about using and disseminating data. And here we give you some tools and some ideas for how to find a story in the data, and whether you're using that data to give a presentation or to do some analysis or reporting, or to do an advocacy piece. There's some different techniques that you can use to sort of dig through all of the mountains of data that you might have in front of you and really distill what's important and give you some ideas for how to get those messages across clearly and in a compelling way. So I'm going to just click through a quick preview of the course, although I think maybe we can also put up the link either in the chat, or we'll put it on the screen in a moment for you to also just access the course on your own on the side. It is hosted on Agora, which is UNICEF's learning platform. So if you have a UNICEF account, you already have an account with Agora, you can go right there to explore. If you're external to UNICEF, you're also welcome to visit the Agora website and just make a free account, and then you can find it there. The name of the course is here, Harnessing the Power of Data to End Harmful Practices. As we said, that the course is organized in modules, so you'll access each one of the modules sort of one by one. And then once you're in each of the modules, there are several lessons that you'll go through, and you'll see a lot of the lessons are delivered as videos. So we'll be, talking you through the concept, and then there's several like activities and games and things sprinkled through in order to reinforce your understanding. Okay, so with that, I will close and hand back to Claudia and to manage any questions that we might have.
Thank you so much, Corinne, and thank you for the questions that were already included in the Q&A. The most recurring question had to do with the language version of the training. So the training for now is in English only, but we are aware of the needs to have the training translated in other languages, particularly in French, and that's what we plan to do. Starting from next year. We want to launch the English version this year, have an opportunity to fine-tune with the feedback we receive from those who enrolled. And once we have a version 2 of the training, we will translate it into French at the very least, and hopefully other languages as well, depending on availability. So the floor is now open for additional questions or comments. We are going to allow for a couple of minutes for that before we close. Okay, so if there are no questions, it's now the time for some closing. Oh, I see now that a hand is up. It was brought back down. Let me see, it's back up again. Amel Salih, would you like to unmute and ask the question, or you can obviously also type it in the Q&A chat. Yes, Amel, are you able to unmute yourself? Yes, Amel? We cannot hear you, Amel, if you're trying to speak, and I can see that now you're typing in the Q&A. Thank you so much, Miriam. Thank you, Jack, and thank you, Amel, for your kind words. So if there are no questions, then we'll go back to the closing remarks. It's my pleasure to welcome UNICEF Chief Statistician, João Pedro Azevedo, who is part of the Data and Analytics section in the Division of Data Analytics Planning and Monitoring, for some closing remarks. Welcome, JP.
Thank you very much, Claudia, Veronica, and Colleen, and colleagues connected. I would like to start by thank you all for joining us today. This is an extremely important topic and event for us at UNICEF, and it has been discussed. The power of data is critical for this agenda. So on behalf of the Data and Analytics team and the Chief Statistician's Office in UNICEF, I want to thank you for your interest in this initiative. Hope that you will join us as champions for data on harmful practices. We believe that good quality data are not just informative, they are transformative. They can serve as a catalyst for informed policies, strategic programming, and the mobilization of resources that give girls a better chance in life. We all have a critical role to play in demanding and using data to improve the lives of children. I encourage you all to register for the course, scanning the QR code posted in selecting the links provided. And please advertise, share this to others. I mean, it's very important that we broaden this community. As this course is the first of its kind, we truly welcome all the feedback that you learners that have enrolled might give us. And please share your impression back with us as a team so we can continuously improve our offering. This is also specifically and particularly important at this moment for us at UNICEF as we embark in our next strategic plan, and when we are putting this kind of indicators and data among our high-level results. So having this data in quality and country-owned and understood not only by UNICEF colleagues, but also partners, and more importantly, governments, it's critical for us to deliver the results that we aspire and work so hard to achieve for girls. So thank you once again for joining us today, and thank you, Claudia, Colleen, and team for producing such an incredible training.
Thank you so much, JP, and thank you, everyone, again. Thank you to the team. Thank you for joining us, and we look forward to having more opportunity in the near future for interaction. Thank you, and we can close the webinar. Thanks. Bye-bye.